Hello, lovely viewers. Welcome to another amazing episode on Health Zone. Today, we are going to talk about insomnia. All that you need to know about this particular disorder, the types of insomnia, and all the natural remedies you can use at home just to help yourself. Make sure you subscribe, like, give us your comment. If you have anything that you want to share with us, just give it to us down there. Let's go for a quick break. When we come back, we'll delve into the matter for today.
Perfect Living TV above and beyond.
Welcome back from that short break. Now, let's delve into today's topic. Insomnia is a sleep disorder in which we have trouble falling asleep or staying asleep for a longer period of time. This condition can be short term, which is acute, or can last a longer time, which is also chronic. It may also come and go. So acute insomnia lasts from one night to a few weeks. Insomnia is chronic when it happens at least 3 nights a week for 3 months or for more period. Now let's look at the types of insomnia. There are 2 types of insomnia, namely primary and secondary insomnia. Now, primary insomnia, this means your sleep problems aren't linked to any other health condition or problem, so it is actually normal. And then the second one, which is secondary insomnia, this means you have trouble sleeping because of a health condition like asthma, depression, arthritis, cancer, or heartburn, sometimes to pain, medication, or substance abuse, such as cocaine, alcohol, weed, tobacco. You can mention a lot. Yeah, so now let's look at the causes of a primary insomnia include. We have stress related to big life events like a job loss or change, the death of a loved one, divorce, or moving things around like noise, light, temperature changes to your sleep schedule like jet lag, a new shift at work, or even bad habits you picked up when you had other sleep problems. So these are all contributing factors. Now let's look at the causes of secondary insomnia. We have mental health issues like depression and anxiety, medications for cold, allergies, depression, high blood pressure, and asthma, pain or discomfort at night. Caffeine can also be a contributing factor. Tobacco or alcohol use can also be a contributing factor. Now, we have hyperthyroidism and other endocrine problems, other sleep disorders like sleep apnea or restless leg syndrome. These are all causes of insomnia. Now, insomnia risk factors. Insomnia affects women more than men and older people more than younger ones. Now, young and middle-aged African Americans also have a higher risk of having insomnia because of a lot of contributing factors and the foods that we take. Now, let's look at other risk factors. We have long-term illness, we have mental health issues, we have working night shifts or shifts that rotates all around, especially from work. Now let's look at some insomnia symptoms. Symptoms of insomnia include sleepless during the day, sleepiness during the day, and then you have fatigue, can also be another major factor, and we have grumpiness, problems with concentration or memory loss. These are some of the factors involved. Now, how to diagnose insomnia? Your doctor will do a physical exam and ask about your mental history and sleep history. Your doctor will do a physical exam and ask about your medical history and sleep history. They might tell you to keep a sleep diary for a week or 2, keeping track of your sleep patterns and how you feel during the day. They may talk to your bed partner about how much and how well you've been sleeping. You might also have a special test at a sleep center that will also aid you in getting your result. Now, insomnia treatment. Acute insomnia may not need treatment. If it's hard for you to do everyday activities because you are tired, your doctor may prescribe some sleeping pills for a short period of time. But medicines that work quickly but briefly can help you avoid problems like drowsiness during the day. Now, don't use over-the-counter sleeping pills for insomnia. They might have side effects and they tend to work less well over time. For chronic insomnia, you will need treatment for the conditions of health problems that are keeping you awake. Your doctor might also suggest behavioral therapy. This can help you change the things you do that make insomnia worse and learn what you can do to promote sleep. Now, insomnia complications. Our bodies and brains need sleep so they can repair themselves. It's also crucial for learning and keeping memories. If insomnia is keeping you awake, you could have a higher risk of health problems like high blood pressure, obesity, and depression. The higher risk of falling is if you are an older woman. Trouble focusing, anxiety, grumpiness, slow reaction time that can lead to a car crash. Insomnia prevention. Good sleep habits, also called sleep hygiene, can help you beat insomnia. Here are some of the tips you need to know. Go to sleep at the same time each night and get up at the same time each morning. Try not to take naps during the day because they may make you less sleepy at night. Don't use phones or e-books before bed. Their light can make it harder for you to fall asleep. Avoid caffeine, nicotine, and alcohol late in the day. Caffeine and nicotine are stimulants and can keep you from falling asleep. Alcohol can make you awake up in the middle of the night and it will hurt your sleep quality. Get regular exercise. Try not to work out close to bedtime because it may make it hard for you to fall asleep since your system is still hyperactive. Experts suggest exercising at least 3 to 4 hours before bed. Don't eat a heavy meal late in the day, but a light snack before bedtime may help you sleep better. Make your bedroom comfortable, dark, quiet, and not too warm or too cold. If light is a problem, use a sleeping mask. To cover up sounds, try earplugs, a fan, or a white noise machine. Now, follow a routine to relax before bed. Maybe you can read a book, listen to music, or take a shower. Don't use your bed for anything other than sleep and sex. If you can't fall asleep and aren't drowsy, get up and do something calming like reading until you fall sleepy. If you tend to lie awake and worry about things, make a to-do list before you go to bed. This may help you put your concerns aside for the night. This is how we end today's episode for today. I hope you learned a lot because I'm also going to practice all that I learned here today and I'm going to use them to influence my sleep this time around. My name is Jennifer Amlade. Thanks for watching.